Hi, this is June, and she is a goose. And June came in a few weeks ago because she was very lethargic, and her owner saw some swelling around her head and her face. She's usually very, very animated, and she's actually being a little cooperative today, but in her usual animated way. We've been treating her with some antibiotics and some antifungal medication and nebulizing her because we were concerned that she had an air saculitis, which is a swelling or an inflammation of her air sacs over her head and her neck. Her owner has described asymmetry in her head where she appears swollen at some times and not at others. And the only thing that really waxes and wanes like that is the filling of the air sacs with air, and then they come down again. When there's inflammation, they don't drain air properly. So right now, I'm looking at her, and I'm looking at her head on, and I don't see any swelling over her face or her neck. Sometimes they will actually trap air in those areas, and they feel kind of like cellophane, a little crinkly, but I don't feel that at all. She's very annoyed at me. I'm going to try to look at her mouth. She doesn't usually like this, and she's going to fight me. Yeah, I know. Okay, okay. Yeah, yeah, okay. So her color is good. She chipped the tip of her beak the other day, but that appears to be healing. And that's the June I know. She's very mad. Oh, okay. I'm glad. This is normally how she acts. So her weight is really, really good. She doesn't feel skinny to me. She's got a lot of feathers, and I'm very happy that she's actually resisting, because usually when she's sick, and other times that we've seen her, she's been lying down and very, very, very lethargic. Okay. Her weight is good. She's got good muscle over her belly. I know she's leaving. Okay, okay. Yeah, I know. This is really hard. And I'm actually going to listen to her chest. I'm going to grab my stethoscope. Her owner describes that she is eating really, really well. And she's been resting, but she's very active today. I'm just going to listen to her. She has a heart murmur, which we don't think is related to her current problem. But her breathing sounds good. I don't hear any wheezing or crackling. And she's breathing with her mouth closed, and she has in the past breathed with her mouth open. She has a condition called angel wing, which is why her wings are sticking out like this, where when she was growing, she's a couple years old now, but when she was rapidly growing as a juvenile, the weight of her feathers actually caused her wings to rotate out as she grew really rapidly, and it's a really common condition in waterfowl. And unfortunately, unless you correct it early, it's a permanent thing, and it just means that her feathers stick out and they tend to break off. And she's leaving again. Okay, I'm going to take a look over here. And this side has it too, but not as badly. Okay. Oh, I'm so happy that she's feeling better. Okay. June is a handful, but that's good. Okay. All right. All told, I'm just going to take a look underneath here too. I know you're not loving this. Okay. All right. Can I look at your feet? I know. Okay. Real fast. Look at your feet. Okay, there's one. I got to see one foot. I'm going to come around and see. Maybe she'll let me just...
I can help you with her feet. She loves her feet massaged.
You know what? Going forward is easier. Can I go forward this way? Can I have this one? Please, please. Thank you. Good girl. Okay. Okay. All told, I think she looks better. I really, really do. She hasn't tried to lie down. She hasn't tried to collapse, and she really couldn't even make it through the exam last time. So I think we're on the right track, and I think we should keep going. And she's trying to eat Peggy's name tag. And I think that we should just keep treating her with exactly what we're doing, because she seems to look better each time I see her. We're going to weigh her and just make sure she hasn't lost any weight, but she's very, very active today, and I'm not ready to change our plan yet. Okay? Okay. We'll see you in a week, June.